Good afternoon, everybody. Let's give everybody a second to kind of click in and catch up. And this is Dr. Gary Lee here at Elevation Health. We're going to do a little update on scoliosis. Remember, this is non-surgical correction of scoliosis. We're not opening anybody up. We're not putting spine or rods in spines and infusing spines here. We're actually getting the deformity of scoliosis to correct non-surgically. So we utilize what's called a Scoli brace, and I'll show you what that looks like. This one's in camouflage, so there's probably at least 25 or 30 different colors and so forth that you can get for this. But as you can see, the brace is made in such a way to really push somebody with scoliosis into an opposite posture and get correction to occur. Those big holes are for air conditioning. How's that? And let some air in there. So by wearing that, we get correction of the spine. And it really has been fantastic and miraculous to watch people, mostly children, go through this process where you're looking at surgery in order to correct some of these curvatures that become so large. And it's amazing to watch them begin to grow normal again, which is a fantastic, fantastic thing. From my perspective, being the doctor, because what I want to do is see change. That's what it's all about for me. But for a child who's looking at surgery and giving up so many things in life versus getting those things back and living a normal life and participating in activities that they would have had to leave behind. What a wonderful thing. So I'm going to give you a little idea of what we're doing. And you saw the brace, and kids wear that, and the adaptations. We see change, significant measurable change in even just 30 days of wearing this brace. And 90 days is phenomenal, and then they just continue to use it, and we continue to get some change and then stabilization. So I'm going to show you a little case here, and of course we can't disclose any information about this person, but I can tell you female, because 95% of cases of scoliosis are female. Only 5% are in the boys. So we look at this, and adults, we can get change, but they're not going to be as significant as we see in children, because you're not growing anymore. And in children, when we say they literally grow towards normal, is because the bone, the deformed vertebra that are wedged and rotated, that short side on the wedge begins to grow and speed up and catch up to the other side. And that causes the rotation to come out of that twisted spine, and it becomes fairly normal again. So anyway, I'm going to show you the x-rays of this young girl when we started, and I want to make sure that you kind of understand where she started from and then basically where she's at 10 months later. And so here we are, and of course you're seeing over here the low back, and we had a curvature that measured 23, I don't know if you can see that, 23 degrees over there on the low back, with some rotation. That's not the primary curvature over there, because if we look at this one, guess what? That one is much larger, 36 degrees. That's the main one. You look at the amount of rotation, and these spinous processes should be in the middle, right? And we get up here, and they're way, way, way off over to the side, okay? So anyway, we look at that, and we say, oh my goodness, that's 36 degrees already, and at the time she started, she was a little younger, and 36 degrees, you potentially could get up to that 45 to 50 mark where surgery is required. So let's then pull up her current view that we took here recently. And again, here we are. And of course now we've got the digital x-ray, so we can look at that as a full spine view. And we, oops, just covered you up there. So let's look at this low back and upper back. So our low back curvature, of course you can see now it's much straighter. There's almost no rotation at all in the low back, just a tiny bit, but it measures only 11.4 degrees, okay? Now I'm going to click out on one line. This was more for a measurement to compare with a prior x-ray that she had, and don't know that I can actually get that to go away, so thought I could. Yep, there we go. Now, oh, by the way, yeah, it's live. So here we are. It's down to just 11.4 degrees from that larger 26 degree curvature that it was. Now let's look up in the upper back. And so up here, again, let's move this down a bit so you can see the top to the bottom of that curvature, and that's down to 14.5 degrees, which is phenomenal compared to the 36 degrees that it was. Now we still see some rotation in some of those vertebrae, and there's still a curvature there, but it continues to improve. It continues to decrease. Now, we've done some modifications to the brace to help that continue to improve, and so we do expect to see more curvature change in the next couple of months. So that's right there. That's what we do with the Scoli brace, and it's amazing. You know, no surgery, no medications, no physical therapy. You know, there's no need to go through all of that. All you have to do is wear the brace. Okay, all you have to do is wear it, and the changes happen. So it's a phenomenal thing to watch happen. I'm excited about it. I have been for 3 years, and I still am. And if you know someone who has scoliosis, there's no better place for them to be right now. Refer them down to Elevation Health. Have them come in and see me, and I can see what we can do to help them correct that curvature and totally avoid the surgical route. Frankly, that's a miracle. And just 3 years ago, you wouldn't have been able to do that. Surgery was your only hope if your curvature was progressive. So share the word, you know, get it out there. If you know somebody, it's maybe somebody else's child, maybe it's a friend of one of your kids, and you know, you see them, they're looking crooked, the shoulders high, hips off. They just, you can tell when somebody has scoliosis. They just don't look the way that they should. But you know, with use of a scoliosis brace, guess what? They look normal again. It's just wonderful. So our number here, 801-974-5555. Get the message out. Share it with as many people as you can. And let's help these kids just to look forward to a normal life and having fun and doing all the things they always dreamed they would until they found out they had scoliosis. So let's get it corrected. Thanks for watching. I appreciate the participation, and I appreciate you for sharing with others that, you know, unfortunately maybe didn't see this video, but because of you, you've created that bridge and you've shared that message with them, and they can get the help that they need. So thanks a lot. Dr. Gary Lee, 801-974-5555. Thanks.